Thank you for joining and listening today. My name is Dr. Renee Pozza. I am a hepatology nurse practitioner. I have been working in the field of hepatology for over 25 years, and it's great to be with you today to talk about non-invasive testing and fibrosis assessment. I think as more and more of us nurse practitioners are seeing individuals with steatotic liver disease, or what we used to refer to as fatty liver, where we want to identify these individuals early, and so we can provide interventions and treatment options for them. So thanks for listening today. We're going to cover a little bit about how do you do some liver fibrosis assessment and what tools you have available for you in the clinic setting as you're identifying these patients. Just in a brief review, you're going to identify patients with what we call metabolic-associated steatotic liver disease, or simple steatosis. In other words, simple fat. There's fat in the liver, and you're trying to assess how much fat is there, as well as is it causing any inflammation, because we know inflammation then leads to what we call fibrosis. And as we get into advanced fibrosis, then we call that cirrhosis. And that is when we identify what we would call MASH, metabolic-associated steatotic hepatitis. And so you want to distinguish, are you dealing with a patient that's got simple fat in the liver and it's not causing a lot of inflammation or damage, or are you dealing with an individual that is progressing? And we know every individual is going to progress through this disease differently. And so it's important for us as nurse practitioners and APPs that we're identifying these patients for treatment. So what do we have as far as our non-invasive testing? You've got some lab options, laboratory options. You've got a FIB-4 is probably the most common. This is a combination of age, platelets, AST, and ALT. And you can either order this as a lab test, or those of you that might have electronic health records or medical records that have it, like Epic, you can ask it to run a FIB-4 for you. And so you might have some access that way, or you certainly could get it through a lab test. This will identify patients that are at risk for fibrosis or are showing signs of fibrosis. There's also an ELF test, which is a proprietary lab test. LabCorp has it available, as well as Quest has it available. And you're looking for scores of greater than 11 would indicate somebody with more at high risk for advanced fibrosis. So those are two lab values that you can consider. There's other ones like a FibroSure. And so depending on what lab accessibility you have, or if you're wanting to do like the FIB-4, which could be more of a point of care testing. Now, there are other things around imaging, and oftentimes you might have a patient that you've done an ultrasound on and the echogenicity is increased, and you recognize that maybe you're dealing with somebody that has fatty liver. There's something called a FibroScan. A FibroScan, or even an MRE, which is a magnetic resonant elastography. So like an MRI, but specifically looking for fat in the liver. Those are some tests. The FibroScan is probably the most common, and it can be done in the office. You want an individual that's trained on how to do these and has, over time built some consistency and some reliability in how they are doing the test. But the test, typically a FibroScan will give you two scores. It gives you a CAP, which is the score for how much fat is in the liver. Individuals that have over 250 on a CAP score, we know have a lot of fat in the liver. Then it also gives you a kilopascal score, which is the fibrosis assessment. In that fibrosis assessment, if you're dealing with an individual that is scoring 12 or greater on the kilopascal, that's somebody that has advanced fibrosis, or what we would be concerned that they have cirrhosis. So then, those individuals that you identify that have more markers of advanced fibrosis, certainly you use that with your own clinical judgment, your history taking, you're looking for, alcohol use. Are there other causes of liver disease? And certainly looking for metabolic factors that are associated. Does this patient have diabetes? They are more likely to be at risk for having MASH along with someone in diabetic. What's their weight? looking at that. Certainly, we know it's associated with individuals and that have obesity or increased weight. So all of that, including their liver function test, look at that. And then a real good marker for you is to look at somebody's albumin and platelets. If individuals have low albumin and low platelets, that's always concerning for someone that has more advanced fibrosis and possibly cirrhosis. How do I use those in my practice? I think that is, every practice is going to be different. If you're working in primary care, if you're working in cardiology, you're working in endocrinology, or you're working specifically in GI and hepatology, you may have more access to imaging testing that you can do. I rely on the FibroScan, and as well as, maybe running a FIB-4 or an ELF test to assess for fibrosis. But whatever you do, please assess for fibrosis, because those are the individuals that we're trying to determine where we can make a difference. And if you're seeing individuals that are what we would call fibrosis stage 2 or 3, that is leading and progressing. You have individuals that are in 0 to 1. Those are the ones that you're going to want to do lifestyle modifications, really encourage them to maximize their diabetes control, their blood pressure control, their lipids, all of those things, as including exercise and weight loss. When you have an individual who's moving into the stages of fibrosis into 2 and 3, that means you have more inflammation and scarring in the liver there. Those are individuals then you might want to consider for some of the new medications that have been approved, resmetirom, as well as the GLP-1s that can be used in those individuals. And then when you're dealing with someone who's an F4 or someone we would call cirrhotic, you have a compensated cirrhotic, and individuals that are showing signs of decompensated cirrhotic with ascites and esophageal varices. They're managed very differently, because then you're considering you have somebody that's got more advanced disease, and certainly a referral to hepatology would be appropriate for those patients. So if you have any questions or you need more information on MASLD and MASH, please refer to the MASH Community Network. There's a group of us, APPs, that are working in this space, and we're happy to provide educational content for you. Please look out for more information and participate in webinars as they become available. And thank you for your participation.